The area around your anus and the lower rectum contains a network of vessels. When one or more of these veins gets inflamed and swollen, you get hemorrhoids or piles. If you are having hemorrhoids, you might notice fresh, bright red color bleeding in the toilet or toilet paper during or after motion. You might also experience symptoms of perianal pain, itching, or discomfort. Sometimes you might also experience a protrusion of a lump through your anus. Although piles is not a major issue and most of the patients suffer in silence for a prolonged period of time before seeking any medical help, but this should not be done. Why? Because some of the presentations of a colorectal cancer and hemorrhoids can be very similar. So, if you are having symptoms of bleeding through your anus, you should always consult a doctor or a proctologist. Number 1 is if your symptoms are persistent. If the symptoms of piles such as bleeding or pain, discomfort, itching is persistent and which is significantly altering your quality of life, then a surgical intervention should be considered. Second indication will be non-responsive to the non-surgical measures. Suppose you have tried over-the-counter medications, you have tried other office-based procedures, but still there is no relief, then some kind of surgical intervention should be considered. Third indication can be if your piles are too bulky and you have a significant protrusion through your anus, or there is a complication such as thrombosis which manifests as recent onset of severe pain, then surgery should be considered. Fourth indication can be repeated bleeding leading to chronic anemia which requires some form of intervention. In those cases, you should consider some form of intervention. The most important benefit of laser surgery is the postoperative pain and discomfort is very minimal compared to the open surgery. The second advantage being you don't require regular dressing unlike open surgery. Third advantage is the downtime. The patient downtime is very minimal. You can easily resume your routine activities within a very short period of time post discharge. The last advantage is the risk of bleeding and infection is very minimal.